Hello everyone. Today we'll discuss another important topic for your preparation that is called Sjogren syndrome. The question is which of the following statement is not correct about Sjogren syndrome? Option number 1, lacrimal and salivary glands are the major targets. Option number 2, lupus pernio is seen. Option number 3, high risk for development of B cell lymphoma, and option number 4, RA factor is seen in 75% of the patient. So coming to the Sjogren syndrome, it is an autoimmune disorder, okay, characterized by involvement of lacrimal glands and salivary glands. These are the major targets, and also there is an involvement of respiratory tract, gastrointestinal tract, and reproductive organs. The characteristic feature is decrease in the saliva and tears, okay, due to the lymphocytic infiltration and fibrosis of the salivary glands and lacrimal glands. Okay, this lymphocytic infiltration, they contains CD4 plus helper T cells, B cells, and including plasma cells. Okay, so option number 1, lacrimal and salivary glands are the major target. This is the correct option. And these patients are high risk for development of B cell lymphoma. Okay, yes. And this Sjogren syndrome, it is also associated with another autoimmune disorder called rheumatoid arthritis. The signs and symptoms of rheumatoid arthritis, it is also seen in Sjogren syndrome. Okay, so rheumatoid factor is seen in 75% of the patient with Sjogren syndrome. Okay, so lupus pernio, option number 2, it is seen in sarcoidosis. It is one of the cause for bilateral facial nerve palsy. So lupus pernio is not associated with Sjogren syndrome. So answer for this question is option number 2, lupus pernio. Okay, apart from that, there is also involvement of renal system in Sjogren syndrome. Okay, one is tubulointerstitial nephritis is the common pathological changes seen in Sjogren syndrome, and renal tubular acidosis, okay, hypophosphatemia. These are the renal manifestation in Sjogren syndrome, but glomerular lesions are very rare in Sjogren syndrome. Okay, and lips biopsy of the lip is essential for the diagnosis of Sjogren syndrome to examine the minor salivary glands, and this biopsy shows there is a lymphocytic infiltration. Okay, so for this question, option number 2 is the answer. It is not associated with Sjogren syndrome. Thank you all.